Hello, and welcome to another episode of Connecting the Dots. My name is Mark Lardner. I'm really happy that you're all here. Before we get started, I'm excited about our guest today. I just want to give you a couple reminders about things we have going on at the If Center and things going on our TCOM channel. You may have seen or already watched, but there's a couple of videos that I would like to recommend. Last week, 2 weeks ago maybe, we had a What If seminar series asking the age-old question of, is a horse better than a therapist? And so if you're looking for the answer to that question, it can be found in the video. I think it was a fascinating discussion about different innovative approaches to how we can better serve the people that we work with. Certainly in this series, we're looking at innovative approaches for translating assessment data into meaningful metrics. And throughout, I think that's an idea that runs throughout all the videos that we have on this TCOM channel. If you're new here, please subscribe. It helps you stay up to date on all the things going on. Things going on are certainly, we have another equip video up for those who are working in the child welfare space with the Family First legislation. We have the conference that's coming up the start of October. We hope that we'll see many of you there in Lexington, Kentucky for our conference. And for more information on that, please visit our blog, tcomconversations.org, where you'll have a lot of information and ways to register for that conference. Okay, so let's kind of get started with our topic for today. I'm privileged to have with us Dr. or soon-to-be Dr. Gavin Reinne. He is a Ph.D. candidate in Epidemiology and Biostatistics at the College of Public Health at the University of Kentucky. And I'm excited to talk to him about not only his experiences in trying to make connections between his work and the data he has and the findings he has with the actual people that he works with, but also to kind of get his sense of how we can make improvements in translating the assessment information we have, the data we have, into meaningful and impactful ideas for the people we serve. So without further ado, I'd like to welcome Gavin Reinne onto today's episode. Welcome, Gavin.
Hey, thank you so much for having me.
Great. It's great to see you. And before we get started, I know that this is a super busy time for you. You are, as we talked about before, you're defending your dissertation this week.
Yeah, this Friday, 10 a.m.
This Friday. All right. Well, I will not make the mistake of asking you about your dissertation topic, because I'm sure you're talking about it. But I will hope to pick your brain about some of these other ideas. Yeah. And one of the things in past conversations we've discussed is your idea around getting an organic hold of the data, which is something we named this episode for, and this idea of the true denominator, maybe the connections between those two. And so maybe you could kind of walk us through your thoughts on those.
Yeah. So, the idea of getting an organic hold on the data is understanding, of course, whenever we're doing, I'm an epidemiologist. So the biggest question I'm always asking, and I propose to myself, my own research, and then propose to my students is, what's the population of interest that you're studying? What's the question? Who's the denominator? But when you're doing practical research, when you're dealing with research that's, has real data implications, that's, it's data that's people's lives, it's not just enough to say, we're looking at white people from the Appalachia region. You need to understand what it means to be a white person from the Appalachia region versus perhaps maybe a person of color from that same region, or to be a person of color from the Boston area. Getting an organic hold on the data doesn't always translate to something that says, here's what I put into my regression equation, right? It means understanding, when I'm writing in that discussion, what are some of the implications, or what are some of the meanings or aspects or lived experiences that influences the data that maybe I couldn't directly put into whatever equation or analysis that I'm doing, but does provide context to the work and does provide explanation for some of the things that I may or may not be seeing in my data. And so when you strive to do that, for the people whose stories you're telling, for the people whose data that your work is based on, it humanizes them and makes sure that the data reflects, because public health data, it's not lab science, right? It's science that's centered around people's stories and their lives. And so by doing that, you ensure that your science reflects that. It makes sure you make sure that the work you're doing continues to recognize that it's about the people that's involved, as opposed to just some, nebulous concept of numbers and statistics that doesn't have real emotional impact. Public health is very unique as a science in that all of your data is very much about people's lives.
So, and again, I could not agree more with you. And sitting here listening to you discuss this from a university perspective, right? So if I'm putting myself in that seat where I'm thinking, okay, so there's a research project, like you mentioned, maybe you're working with people in Appalachian or in Wisconsin or in Boston, where I may feel a little bit disconnected, only, partly regionally, but
Yes.
also because this is not information, this is not data that I've personally collected. And so,
Yeah.
how do you, if you kind of strive to really find the faces behind that data, how do you do that? What are the steps you might recommend or the steps you might take?
So, of course, it's going to be dependent upon the type of data work that you're doing, the type of thing that you're going to do when I worked on a project around children's tuberculosis, the steps that I get to understanding children's data is going to be different than what I did when I'm trying to understand Wisconsin's data. So my dissertation is about child welfare in Wisconsin, and so I didn't have the time, of course, and then of course during COVID, it's not like I could fly out to Wisconsin and get a handle and talk to social workers there to get a concept of there. So really, what you want to do in that case was about taking the time to understand, to read. I read tons of stories and articles, both actual reporters and then people who are just talking about their experiences. I read blogs of people from different areas and walks of life in Wisconsin who were coming from backgrounds and areas that were going to reflect on people who came in and out of the child welfare service system. Of course, I read other studies that explained, that looked at how things that weren't necessarily related directly to my project, but we're talking about what it's like to be in child welfare in some way, shape, or form, or coming from different backgrounds. I read, articles and things like that about people from different geographical spaces, from the areas that I was interested in studying. And so you have to, I'm a strong believer that you have to try to understand to the best of your ability just the area that the people are coming from, their experience the best way possible. In an ideal setting, in other projects, what I've done is I've actually just actively interacted with those people. I've actively reached out and said, hey, I'm doing this project and I want to make sure, what are some things, even if it means asking, what's a question you wish a scientist would ask? Because, and then letting that be the jumping point for a conversation, because oftentimes, in other projects when I've done that, I once did a project on homelessness and access to food and healthcare. And, that project, similar to the one I'm doing now, it was all secondary data. I wasn't the one collecting it. I wasn't the one designing the surveys and things like that. But I happened to have access and the ability to reach out to certain homeless centers. And so I took some time, took a couple of days, and I talked to people there and I said, what are some things that you would like a scientist who's trying to understand what it's like to be homeless here? What are some things that you wish they knew or knew to ask? And so that sort of approach, reaching out, kind of trying to make sure that the people that you're studying, that they are the ones advocating for them, or that you're trying to be the appropriate voice to advocate for whatever's going on in that situation. That helps you center and helps find out will help you find where you need to go to get the voice you're trying to hear.
That's interesting. Yeah. So I think, in the past couple episodes, I've met with a couple of different people. We've talked about it kind of from a data scientist lens, different ways of doing analysis, different ways of presenting data. At some point, it does start to feel like, in some cases, maybe we're just pushing numbers around, right? And you can lose, what kind of you're suggesting, this idea that there's a face behind this data. What are some of the pitfalls, maybe of not really being careful or really paying attention to that there are people here and that there's stories behind all these numbers that are collected and that we're trying to manipulate?
I mean, so you can categorize a couple of different ways. So on a science, just a pure doing good science, doing writing, I have watched people make very obvious blunders because the problem happens when you are so busy saying, okay, does it fall into this equation? Does it look like this in the regression? Sometimes what ends up happening is you end up making statements or finding explanations that don't really make sense, or you miss things that are really obvious. So I once was at a project and was at a seminar, and a guy was talking about cancer and cancer mortality differences. And he said, well, we don't really understand why Black female mortality is higher than white women. And he was in an area he was in, there was a lot of poverty, and he took no time whatsoever to think about economic differences, racial differences, bias in medicine. There was none of those explanations. So when you asked him kind of those questions, the research was solid, his research time was great. But when you asked him about kind of, have you asked these women that you're studying their experiences in medicine, it hadn't even occurred to him to do it. So some very obvious explanations that would have provided context and more meat, essentially, to his project, he doesn't have. So, there's that basic, are you doing good science? And are you overlooking things that might kind of provide some answers to you immediately and, give you some next research steps is really important. But then on the practical level, I have on numerous occasions had, communities, non-scientists say, yeah, when I hear you scientists talk about this, it's like, you don't care about me. You don't listen to me. Or the question you're asking is irrelevant. My mentor, when I was doing my master's, when he finished his PhD, he was a cardiovascular epidemiologist. So he went to a poor area in New Jersey. It was his first job after he finished his postdoc. And he said, I went there to solve heart issues. And for 3 4 months, nothing happened. None of his initiatives worked. Nobody cared. And it wasn't that they were bad. They just didn't take off. And so he asked the local person who grew up there, why are you guys not interested in it? He was like, well, we're more interested in whether or not we can get a job or food. And so, on the practical side, the people that were actually interested in helping and understanding, we do work that's more effective if we actually understand what they want. Right. Because we're responding to their needs and not just our own personal interests.
Right. So this is then the struggle that I sometimes can see happening is this idea that, okay, we need to collaborate, the collaboration between the data scientists, let's say, and in your work, the epidemiologist and the people that, again, are either the study group or the people that we're trying to serve. So how does that collaboration then come together? Because it seems like there's so many barriers built in to getting, to that idea that we can work well together, or even to this idea, the feelings of people say, well, you're caring about things that I don't care about, right? And so, similar to the question before, right? What are the, strategies around here? But how does one navigate some of those barriers to help kind of bring that collaboration into something that feels real, right? Yeah. For data scientists.
I mean, it's about genuine intent. I have at times had to, work on projects that maybe the average person themselves is like, okay, sure. When I worked on an issue around glioblastoma, the average person isn't necessarily going to be overly concerned about that particular issue, but it is important and it is a health issue of interest and of note. And so you reach out to that particular subgroup very specifically. Sometimes it's about making the case about why what you're doing matters. So I know a person who worked on, who was looking at green spaces in disadvantaged neighborhoods or neighborhoods with higher crime rates. And the thing that she had to do was have a conversation with herself first about, okay, she knew what she was doing mattered, but she had to think about what's the implications for this work. And once she was able to vocalize, here's the implications for this work in this community, here's how this would help this community, then she was able to reach out to those community stakeholders, leaders and whatnot, because she needed some recruitment. She needed to recruit people for her project. And so once she was able to make the case then to the stakeholders, the implications, this is why this matters. So I'm not saying that we just need parks while you're thinking only about jobs and safety. I am saying by the implications of my work is the sort of thing that can improve all these other areas. And so sometimes the legwork is on you to think about the benefits and the significance of your work, and then figuring out how to communicate that. Because even outside of that, people tend to get excited about working with scientists, but you've got to be able to explain why they should be excited about working with you and what's the value there. And so I've very rarely ever had a time. I've very rarely had a time where somebody's just like, I don't care about public health at all. Public health is easier that way, to be honest with you, in that, there's always some buy-in, something that somebody can relate to, but you have to be able to sell that buy-in.
That's an interesting and important point, right? So this one, I think the two things you said that stuck out to me were, one, all right, being able to articulate that vision, right? So whatever that is, and then being persuasive. And I think that probably carries through for most of the work in this space, is that, you do have to sell a little bit or persuade people that the work you can do, that they can do with you or you can do with them, is actually going to lead to a global benefit, right? For them, for us, for everyone involved. So let's talk about another thing that I think I'm always curious to get people's thoughts on, but the language that we use kind of in either the academic enterprise or when publishing research, how do we create language or craft language that doesn't create more barriers, but actually helps us connect with the people that we're writing about or trying to problem solve with? And what would your thoughts be on kind of how to do that well, what works and what doesn't work?
This is a challenging one, obviously, because when I think about what I have to write obviously right now I'm writing my papers for publication, and some of the language, they tell you that to be objective, you have to kind of decenter, right? You can't use words like subjects or things like that. And the trick, I think, there is to just code switch to the appropriate spaces. So when I'm on an individual level talking to people, I don't say, oh, I'm gathering subjects. I say, oh, I'm gathering people because I'm interested in a project or something like that. If I'm writing for an academic space versus I'm writing an article that might go to somebody's blog or a local paper, something like that, I just adjust my language to just make sure it's very clear that I am aware that I'm talking about your life. Right? Public health I'm a big believer in just really emphasizing that public health, all of my research is funded by taxpayer dollars because they're interested. They believe there's a contract there that they help fund me to get my education, to do my projects, because the work I'm doing is going to improve your life in some way, shape, or form. And so I try to make sure that language is reflecting that I'm seeing you as a person. I do see your life. I do see your value. I do see your meaning. And I also make sure that whatever issue I'm talking about, there's no blame, and there's also no victimization. So, I think in my bio, I talk about my real strong belief in empowering communities. And the reason being, I think sometimes, especially in public health, we can get into the habit of saying, oh, this community is afflicted with this, or they're suffering from this. And that may be true, but our goal is to not only improve them, but more importantly, to give them the tools to lead a more resilient life. And so making sure that we recognize them as people, and that we also recognize that they're not victims, because people don't like to be talked about as victims, as people as just victims of circumstance.
That's interesting. Yeah. And I think so the way, again, in the literature, right, this idea that we're objective, or that, we need to kind of remain centered on things, does create that barrier a bit. But I guess listening to what you're saying, that maybe there's other avenues too. There's other spaces which we should think about for academics or data scientists or people doing this work, that there are outlets for how we communicate findings or communicate our analysis that are beyond just those narrow kind of research oriented spaces. And so, so talk a little bit more about that, right? So, whether, again, so this is something you and I had spoken about in the past, that sometimes when you write things, you never know who's going to read it and who's going to pick it up and what soundbite or quote they'll think. And so what are ways that we can be intentional about making sure that we're communicating things that are clear and don't victimize, don't present people as victims, but also invite them into this conversation or collaborate with them on the work that's being done.
Yeah. So, when I think about that, part of, there's every people at their different echelon and kind of levels in their career are going to have a bit more power control over some of those things than others, right? So if you're a person who's more senior, when you write, you have a bit more freedom to say, oh, I'm only going to say it this way. I'm going, because you have the professional freedom that somebody, as opposed to me, who's, I'm going to be a junior colleague, in the next couple of years or whatnot. So there's a little bit of difference there. But at all times, what you can do, both in moments like this, where I'm doing an interview panel here, or when I do a quick interview when I do a presentation, all of those little moments, even if it's just to say a quick sentence, something along the lines of, we recognize that the people we're talking about, I recognize the importance of the community, their circumstances, their experiences. It sounds like such a simple write-off, but I have on numerous occasions had people from whatever community I'm talking about reach out to me, either right after a presentation or sometime later when they saw me walking around or doing another event, and say, I saw you did this, and it stuck out to me that it seemed like you really were listening to me and you actually cared. So sometimes you have to use whatever language is appropriate for the venue, but taking a quick sentence or two to acknowledge and say, this is who we're talking about, this is why this matters, and these people's stories and their voices deserve to be heard. Something as simple as an addendum, a final message, a lasting message, recentering what your story is about, what your project's about, and who it's about, and why it matters. I have on numerous occasions personally and through other people who have gone on to do the same thing, watch people reach out and say, hey, I heard you and I'm interested in working with you. I've had church leaders reach out to me and say, hey, would you be interested in talking with my community about some COVID issues, especially during the height of COVID? That happened quite often, where, I was talking about children's mental health and things like that. And I was doing a thing for a high school group, and just kind of doing a presentation on introduction to epidemiology and what epidemiology looks like in the context of COVID. And talk about mortality, and we're talking about the numbers and statistics, because it was like an advanced science class. And at the end of it, I said, we're talking about statistics and we're talking about mortality rates, but remember, we're talking about people who are dying in comparison and reflection in comparison to a population as a whole. So make sure you understand that all of these numbers have stories and names and families, and there's tears behind all of this. And a week or so afterwards, I got a slew of emails from, teachers who joined in, who'd asked me, oh, would you talk to my church group, or will you talk to this group here and whatnot? So sometimes, of course, the language is the language, right? We're talking about mortality rates. There's no cuddly way to make mortality rates sound, a little bit more approachable. But at the end of it, saying there's lives here, and these lives matter, and these people matter. The numbers and the language, the jargon, that's the jargon. But all of that was created to talk about real people. And so sometimes that simple sentence alone will, grease the wheels of perhaps a person who gets a bit more objective because they're nervous or something like that.
All right. Well, Gavin, it is always such a pleasure to talk to you. I think these kinds of ideas and some of the comments, I don't know if you can see them, make reference to that.
Yeah.
These, while simple ideas, are incredibly important. I really appreciate you coming on and sharing them. I cannot say how much I appreciate knowing everything going on with your dissertation coming, your wedding, everything going on, how generous you were to give us your time. I really appreciate it. It's been a pleasure. And maybe sometime, it would be great to get a panel together as we're reviewing some of this big the data, and get your perspective on how to translate some of that stuff, so that we're not losing these ideas about the people behind the stories. So, all right. Well, thank you so much.
Thank you so much for having me.
All right. Great. All right. Well, this half hours goes super quick. Thank you all for tuning in. Again, please click the like and subscribe so you stay up to date on everything going on in the channel. And our next episode we'll have Dr. Kate Cordell from OPICA talking about person-centered innovation solutions. So I'm looking forward to that. Hopefully she'll share some of her data system, her dashboards, and some of the projects she's working on. And that'll be on May 9th at 3 p.m. Eastern. After that, so please also look into our tcomconversations.org. Ari and Brandon help manage the blog. There's a lot of great stuff there. And keep up to date on the conference. We really hope to see as many of you there as possible in Lexington. Lexington's actually a fun town. They do roll up the sidewalks a little early for my taste, but there is a lot of fun to be had. And certainly at the conference every year, it's great connections. And certainly I learn a ton from everybody's presentations. So thank you again for tuning in. We'll see you in a month, second Tuesday, May 9th. And until then, be safe and be well. Thank you.